Give a brief introduction. So we had a really great discussion with some of the senior professors and so many professors and teachers sitting in front of me. To summarize what we learned in this 1 hour, so something about the ideal teacher in ophthalmology and ideal setup. Yes, a good teacher and bad setup. If you have no instruments, even a good teacher becomes handicapped and he cannot teach well. A bad teacher and good setup. Again, same thing happens. A bad teacher, he doesn't know how to handle the instruments and what he can teach. So both are complementary to each other. So a ideal teacher flourishes when he has got everything with him. So of course, what I would say, when we were students, etc., a lot of equipments were not available in the medical colleges. But nowadays, with government's interest and government's given us a lot of instruments. Even I would really happy to announce that sometimes in our local medical college there are 3 laser instruments, 3 phaco machines. Everything is there nowadays. But only thing, we have to build up a good teacher. As Professor Tital has already said about the bedside teaching, and also Dr. Suchita also told about the bedside teaching is very important. But nowadays, present day circumstances, as one of my colleagues has told, that because of this AIOC2024 Yojana, and although we are in a hurry to finish up the surgical cases to get money. So many of the primary criteria nowadays, and teaching has gone to the back door. Nowadays, recently, in many medical colleges, this is the practice going on, to earn money at a short time. In that way, we lose so many things to teach a good, prepare a good student. Nowadays, we are lacking that. And one of my colleagues said, why he became a teacher in the medical college? Yes, teaching is a profession. Many times we are really, when we see our teachers who are teaching us, we feel that yes, once I should also become a good teacher. I must, but are we doing justified? When we become a teacher in the medical college, are we coming regularly to the institution? Many times I've seen some of the medical colleges, the teachers are not in time, they're not sincere in teaching, they're not preparing themselves before coming to the institution. And they've got so many problems with them, so they don't want to teach. So that's why there should be protocol in the college, medical college. Whoever comes to teach a student, he has to follow all these things so that at least we can prepare a good student. So to make a good student, we must have a good teacher also, and teachers also should be up to date in the knowledge. They should have the knowledge and encourage the students to go for the research and public. The teacher should know how to prepare a case sheet, how to prepare a case history. Everything has to be the teacher will good. If he is good, then only he can teach the student, and the student will be a good teacher. So that's why many times, even after the completion of 3 years degree course in medical college, in the postgraduate degree course, the students has to run to the private hospitals, maybe Arminda Hospital, LPS, because what is there? Why they are different from our medical colleges? But there is regular protocol is there, then you have to follow that protocol, and automatically you learn within 6 months to 1 year what you have not learned in the medical colleges. There also the same thing, problem, but still then, wow, you become a good surgeon after completing your fellowship, not your postgraduate, whether it's MS or DNB. Yes, SSTC is the need of the hour. Surgical skill training, because as everybody has discussed, I don't want to go into the details, but hand and eye training, that is very important. So simulated training is, I've seen the simulated training, I have done also the simulated training in this Help Me See simulator machine in Mumbai, and some of the conferences they have come. They taught us how to make your hand and eye coordination possible, and we have lot of students we sent from our place to go to the Mumbai Help Me See. They conduct regular programs and this under the simulated training. So this simulated training, it is really very expensive instrument, but it's really useful to the students to learn some basic steps. And of course, once you learn the basic steps, you should have wet lab in all medical colleges. You should have wet lab, and you should get the goat's eye to practice your hands. And as somebody's already, Dr. Saban Shaman told that there are some Painful blind eyes. You get a lot of painful cases or sometimes trauma cases where the eye is lost, where we enucleate. Why not to try in those cases some of the surgical procedures when we make our hands, skilled. So, already there are two other topics already discussed by Dr. Behra and Dr. Suchita. This is the importance of bedside teaching and importance of having a good resources in the medical college. And still, in spite of all this, nowadays, in a medical college, I will tell a few examples in our government, in our states. There are number of medical colleges have increased from primarily 3 medical colleges. Now it is about more than 11 medical colleges. The faculties are very, very minimal. We don't have much faculties. And these faculties transfer to the other medical colleges. From the other medical, they come to here. So like this, the faculties are very few. And the students have also been increased number. In a medical college, there were 27 medical postgraduate students. And hardly there are 3-4 faculty. The disproportionate student-teacher ratio. That is also harmful to the student teaching. So, really, it's a good thing that the 40 takes up so many issues, and simply sitting here having hardly only 10-15 members doesn't serve our purpose. So all of us sitting here, please give us a suggestion. We must put it into our people who are doing the formulating the rules and regulations. We have to put to them, either NMC or the head of the institution, or the All India Institute of Medical Sciences. So we have to do something. So sitting here and not in the 4 walls. It has to come out of the 4 walls. It has to be given to. So thank you very much for joining in this program. And yes. So thank you once again on behalf of the 40. As I was the last time I was the secretary, recently I have taken the vice president. So I invite all the people to join us in all the 40 sessions in coming future. Thank you very much.